Good evening and welcome to Manhattan COVID-19 Town Hall, Testing and Vaccines. I'm C. Virginia Fields, founder and president of the National Black Leadership Commission on Health, and I'm joined by some very distinguished speakers and people who are directly on the front line here in New York City in addressing testing and providing vaccine, whom I will introduce shortly. But just before I do that, let me say a few words about Black health in terms of why we are even conducting these webinars. Fortunately, we have been provided a grant through New York City where we're involved in doing outreach, education, and providing information and resources throughout the city. And as we do our work, we become very mindful of the disinformation, the myths, the lack of information that we continue to hear from people in the communities. And what we've said and continue to say is that with all of the information out there, there is still a lot of myths, misinformation, and lack of information. So we're conducting town hall events in every borough. Our first one was in the Bronx in December of last year. This is our second one here in Manhattan. We will be following one, doing one in Brooklyn, Queens, and Staten Island. So that's the purpose of these events, to inform, to respond, and to engage our communities more fully in terms of this fight. So I want to thank everyone who is a part of making this possible. My co-host, Gale Brewer, who of course is the president of Manhattan. And when I saw that, Gale, that you are the 27th president of the Borough of Manhattan, I recognize that that makes me the 25th president of the Borough of Manhattan. So thank you for allowing me to put that number out there, number 25. Gail Brewer, of course, is someone we all know, and she has a long history, distinguished record of public service, and she does so much. And we always invite you to go to her website where you would learn so much more about what she's doing and what she continues to do. We're also joined by Ebone M. Carrington, who is currently the Chief Executive Officer of New York City Health Hospitals, Harlem. And of course, Harlem, New York City Health Hospitals is a public hospital that serves the communities of West Harlem, Northern Manhattan, South Bronx. And as the Chief Executive Officer, Ms. Carrington provides leadership to the hospital's outpatient, inpatient, emergency, and critical care units. We're also joined by Dr. Jeanne Carey. Dr. Carey is the Chief Medical Officer of Ryan Health and also serves as Ryan Health's Infection Control Officer. She completed her infectious disease fellowship at Beth Israel Medical Center. And we're joined by Dr. Julian L. Watkins. Dr. Watkins is a city medical specialist at the New York Department of Health and Mental Hygiene. As clinical associate to the Deputy Incident Commander, he also leads a very important staff group in the emergency response where they are tasked with educating agency staff on the available COVID COVID-19 vaccine and addressing vaccine hesitancies. So this is our group tonight, people who are out on the front line, people who are well informed and well prepared to lead in this discussion. So I also want to thank, of course, Manhattan Neighborhood Network, Executive Director Zenaida Mendez, who has helped to make this possible tonight live on MNN. And we encourage you to please support the Manhattan Neighborhood Network. And I want to thank Freddie Pinto and his team for working with us, enabling us to bring this live to you tonight. So we are live, we are happy about it, and let's get exactly to many of the questions that we have. And I'm going to suggest anyone who wants to respond to a question, feel free. And if there's a specific one around your area of responsibilities, I will also ask you to do that. But just generally, you know, so much is coming up every day in new information, every day. People are really anxious, and sometimes I am too. I have to turn out the TV. I cannot watch it like that, and I have to calm myself down. So what we're hearing out there, people are asking a basic question: should I take the vaccine? So let's start there. What do we say to those who are out in the communities asking, should they take the vaccine? Gale?
Sure. I will be honored to start, and I want to thank you, Madam Borough President, as I always say, and also congratulations on all the work on the National Black Leadership Commission on Health. And I understand Senator Warren in Atlanta was and is a chair. So it's a very special organization. So I just want to, there are others, amazing other panelists who are better qualified than I am to talk about whether or not to take the vaccine. I would just say yes, but there will be others. I just want to talk a little bit about what happens in our office in terms of talking about health, particularly in communities of color. First of all, just the statistics, which might even push people more to take the vaccine, I think. Up to now, in the borough of Manhattan, 3,456 people have died. In the city of New York, in the 5 boroughs, up to now, since the beginning of this pandemic, 26,249 people have died. And in the United States right now, in the last month, in the United States, 83,000 people have died. Brazil, South Africa, United Kingdom are apparently supposedly on their way. So the reason I mention all that is, from my perspective as a borough president, I still see the challenges of figuring out how to get the police and or the funeral parlor into homes when people got sick at the end of March. So we didn't know what to do. And then I remember begging to get donations for masks. And then I remember working really hard to try to get food to the homebound seniors. And then I remember more recently, and much thanks to the Department of Health and Ryan and Health and Hospitals and Harlem Hospital working on testing. And here we are today with the issue of vaccines. So about a week or 10 days ago, we wrote to the mayor stating that we were worried about the vaccine rollout, because that's more than what I've been working on, as opposed to the issue of whether you should take it or not, because many people do want to take it. There's a lot of concern, particularly in the African-American community. But for those who do, it has been very, very challenging. So we wrote a letter, making some suggestions as to how to work with the senior centers, using some mobile vans, like the one I know that Ryan has one, the city has mobile vans to get into the communities, making sure NYCHA gets service as they always should be. And we learned a lot from the testing, because we have learned who would be involved and how to get people testing and how to reach them, even though I can't say it was a greatly organized situation. And we're still testing. But in terms of the vaccinations, what we ended up was a state program, to be honest with you, 2 city websites, different hospitals. Then we also had private hospitals have their own websites. Sometimes the CDC came in. They had some buildings that they were working in. I think the veterans, the VA had their own process. So it has been very challenging. So yesterday we had a wonderful, I would say maybe 300 people on a Zoom call with questions and suggestions. We tried not to be just complaints, but what we could do about this situation when and if we get more vaccinations. And my understanding is some coming in, thank goodness, for the new administration in Washington. So the short version is, particularly in communities of color, you saw in The City, which is an online newspaper today, that a reporter, to her credit, went to the Armory at 168th Street, and she found it to be primarily white in line, despite being a Dominican community. Dr. Cheryl Smith, who was on the line with us yesterday, it was at Aqueduct, and she found that many, this is in Queens, many of the persons who came in to get vaccines were from Long Island and were white. And yet we know who has been suffering the most in terms of this pandemic. I talked about the deaths, the masks, the testing, the food, and just trying to get support. I won't even mention the schools and all the other challenges that were and continue to be challenging because of this pandemic. For us, it's a constant every minute with really a new situation. So now in terms of the vaccinations, we really want to have one website. I know that's like asking for the moon, the sun, and the stars, but we really want one website. We want to be able to say to a senior from night, you can also call. We want to be able to say to the senior centers, get on the phone, call every single one of your clients. We want to be able to see those who have DRE and SCRE, which are the opportunities to freeze your rent. Department of Finance has that list. Call them all. They have to make less than a certain amount of money, $50,000 a year. Call them to see, particularly in neighborhoods of color, do they need to get a shot? Can we help them get an appointment? And when I say the seniors, I'm talking about all those in class 1A and 1B. I'm using the seniors as an example. Homebound, what exactly is the process for getting homebound? Are we going to work through those who deliver food? Are we going to work with visiting nurse service? How are we going to make sure those folks get service? Are we going to work through mutual aid, a wonderful organization that during the pandemic delivered to those who are homebound? There are many other such organizations. How are we going to do this? What about these vans? Can we not get vans mobilized and drivers and insurance to make sure that they do their job? I hope you're getting the idea, because we know that Black people are 1.4 times more likely to catch COVID, 3.7 more likely to be hospitalized, and 2.8% more likely to die. And yet they are getting, and I think you saw the story, I mentioned it in The City, that look who is in line. And let me tell you, I tried for seniors calling me to use that multitude of websites, and I'm tech savvy. You couldn't get an appointment. So if I know how to do it, manage, but couldn't, how in the world is somebody who doesn't even have the apparatus be able to get any kind of an appointment? We know that 3% of Americans have received at least one dose of a vaccine so far, but in 16 states that have received data by race, and we haven't gotten that yet in the city of New York. The mayor is supposed to provide it on Friday. We'll see. But where the 16 states have released by race, those states, white residents are being vaccinated at a significantly higher rate than Black residents, sometimes 2 to 3 times higher. And of course, when this happens, you already have the mistrust in terms of the vaccination, and now you add it to the fact that people who need it the most are not getting it. So I'm here to say, I'm sure that your other guests will have much more specific health information than I could possibly provide. But I want to say that from my perspective, there are not enough sites. The only one in Washington Heights is this very large. There are very few sites in Harlem. There are none in West Harlem. There's only one in East Harlem. Even when one high school was offered today, giving out vaccinations, it wasn't on any website. it was a word of mouth with this particular high school. Only when we called, with all due respect, the Department of Health, did they add it to the website. So I'm here to say we've got to have a streamlined process. Obviously, we need it for everybody, but particularly for those who are not competent using devices. We've got to find a way, calling them, working with them, transporting them to get the vaccine if they wish. Thank you very much, Madam Borough President.
And thank you, Madam Borough President, for that very, very excellent and comprehensive overview. You provided a lot of information in terms of what your office is doing, and we're very hopeful that if people didn't know it, they know it now, and that they will reach out to your office, as I know they always do, because this is so incredibly important. And of course, you touched upon all of the problems and the concerns too, that we continue to hear about not being able to get the vaccine, even though one is in that category and it is in their development. And I think one of the things that's really disturbing is the fact that as we move into NYCHA development, they cannot even get it in their own building. So we certainly do appreciate your overview. And as the questions come in, we hopefully, feel free, certainly, Gale, to continue to add to that, Madam Borough President. So now this is a general question for our other three guests, and that is, why should, or what should be said, or why should people take the vaccine? As we confront this question out in the community, why should I take the vaccine?
Madam Borough President, thank you for inviting us, and Mrs. Fields, thank you so much for the question. I think it's very important for us to share with the audience that the relentless pursuit of the return to normalcy is almost solely predicated on our ability to begin to roll out this vaccine, this very critical vaccine. And I have seen families disproportionately impacted and separated. I have seen mental health become much more prevalent during this period. And that return to normalcy can really only happen when more people begin to appreciate the efficacy of the vaccine and the reasons behind their taking it. Specifically, as a non-clinician, I would say in the communities of color, there is such a dark history of medical experimentation and of mistrust in the healthcare continuum that I understand, I appreciate, and I acknowledge that. But in this particular scenario, death is the sentence for the people of color in New York as it relates to COVID. And the way to mitigate and to minimize that death toll is to begin to get vaccinated. What we have seen at Harlem is that many of our seniors are enthusiastic about receiving the vaccine. But to your point, and to many of the points made earlier, it is inaccessible. And specifically, our allocation at the facility has been significantly compromised. So I would say if we want to return to normal, we should absolutely become open to vaccination. And from a public health perspective, in terms of access to care, people are still very fearful to come into hospital settings because they do not feel protected. They feel as though they may potentially get COVID, which was a big part of Wave 1's message, which was stay home to keep yourself safe. That is no longer the message, but I think that it hasn't caught up yet. And the only way to get people to feel more comfortable coming out would be to ensure that they are appropriately protected by virtue of vaccination. So that's what I'd like to offer.
Okay, all right, Dr. Carey.
I would say from a clinician standpoint, this is a great vaccine. What you want in a vaccine is something that's really effective and also something that's safe. And both of the two vaccines, the Pfizer vaccine and the Moderna vaccine that are available now, have approximately 95% efficacy, which is terrific for a vaccine. That's a great efficacy. Additionally, they're very safe. In the trials, which have been done on tens of thousands of people, the side effects are mild to moderate. The most common side effect being some pain at the injection site in the arm where the vaccine is administered. Other side effects that may develop, such as fever, fatigue, headaches, feeling a little fluish, last for maybe 1 or 2 days and occur in probably 10% of people, to the extent that they may feel they have to rest that day or not go to work. But most people tolerate the vaccine very well. And actually, the fact that people have some reaction to the vaccine is actually a good thing. It means your body's reacting to it. It means that your immune system is recognizing it and doing what it's supposed to do. So it's, you know, I can't emphasize enough how important it is in terms of the health of the community for people to get the vaccine, and in terms of both the health to the individual and also the health of the community. It's you know, it's really almost a light at the end of the tunnel for this pandemic. Obviously, it's not an answer to everything, but it's a very effective vaccine, both of the two that are available now, and very safe.
Thank you. And Dr. Watkins, I'm going to ask you to respond to the question, but to add to that, one of the questions we've seen come up from a viewer or a statement that this is so confusing to seniors, everything that they are being asked to do. So if you add that to your response, please. It's very confusing for seniors.
Good evening, everyone. Yeah, so I would say from a public health perspective, I think it's important for us to really take a step back and just try to understand, how does the pandemic end, or what does it look like to end the pandemic? And unfortunately, you know, it's gonna take a huge national effort to really get this thing controlled, and for us all as a society to kind of build an immunity against this thing. You know, we've seen and we see over and over again every day what the consequences of getting infected can bring. And the vaccine represents a way to get immunity against this thing with very minimal side effects, and not many people, you know, people aren't dying from the vaccine, versus the only other way to get immunity is actually be infected. I think that the borough president really touched on a lot of really key facts to the other side of that story, where it's not just getting vaccinated that will get us out. There's the non-pharmacological interventions and the societal factors that I think are really important to getting us to the other side as well. Without a vaccine, we got through the first wave, and that was through, you know, folks coming together separately and socially distanced, but, you know, wearing masks and doing what needed to be done. And that's going to be the key to get us out of this. So there's the social factors, and it's about getting folks access to healthcare. It's about getting folks, you know, helping folks be able to isolate at home safely if they are sick or if they are exposed. So it's a two-pronged approach to get folks vaccinated, and really share the message and get the messaging correct with the vaccine, because I think that this is actually a really major modern medical miracle that we've gotten, you know, that within a year we've gotten something that's safe and super effective within record time, meeting all the safety standards, and we're still monitoring this vaccine every day. And we're going to keep monitoring this vaccine as more and more people get vaccinated. So I think it's the fact that we're continually monitoring for safety, and that even we can't let, as a community, as Black folks, as Latinx folks, as people who come from other communities, we can't let a lot of that negative history block us from, you know, getting to the other side and really seeing the vaccine for the merits that it is, but also holding folks to task about those social aspects to get us to the other side too.
And while you're speaking, there's a follow-up question that has come up that I'd like to ask you to respond to, given your profession too. What's in the vaccine? Someone just posted that question.
So I'll answer that, but before I say, it's very confusing to seniors, the whole process, and understanding that this is going to be, with this emergency response from the very beginning, it's been a work in progress the whole time. And I just want folks to know that within the health department, there are hundreds of folks who are advocating to make this process better, who are constantly working on improvement and trying to make it more accessible to folks. So we definitely hear you, and there are folks who are advocating and doing the hard work to get this available to folks who need it the most. In terms of ingredients, there are 3 main ingredients in the 2 available vaccines. So there's the genetic component, which is the mRNA, and mRNA people say it's a brand new thing. So basically, mRNA is one of the basic building blocks of life. You know, we've all heard of DNA, and when a lot of folks may be familiar with the like double-stranded helix thing that looks like a spiral staircase. Well, mRNA is what our bodies use to actually get the messaging and express all of the genetic materials, all of the genetic code that we have inside of us. So they've used technology to work with our body's immune system to create a very particular small part of the virus so that our body can make immunity without coming in contact with the virus. A small piece of the virus, where if you think to get infected, you need the whole car. The virus is a car, right? The vaccine just teaches you how to make the steering wheel. So you get your body creates a small piece of the virus, something similar to the virus, so that your body responds as if it saw the full virus. So you can't get sick. So there's genetic material. There's also something called lipids. These small little particles that are in the vaccine that help protect the very fragile mRNA. That protects the mRNA, and it also helps your body uptake the vaccine into your cells. And then the last component is basically like a saline solution, which is a very common solution that we see in a lot of medications. A lot of folks, when you think about saline, you think about IV bags. So like if you get a IV bag or you go to the hospital or whatever, that's normal saline. So it contains the saline solution, which helps with making the vaccine liquid and helps make the vaccine actually mimic your body's chemistry, so that when you get the shot, it doesn't cause a bigger reaction. Saline is very common in other vaccines and other antibiotics and other medications. So those are the three main components, and the difference between the two brands are basically the recipes that the companies use to make all of those things.
Thank you for the very comprehensive answer. Madam Borough President, I'm going to go to you on this question, as it has to do a lot of the outreach and the work that I know that you do. What would you suggest to listeners and viewers about ways to best share the message, the good information?
I think it has to be trusted partners, which is what you've heard from others. Because what happens now is we learn this with the testing, and we learn this with just giving out masks and food. You want, if you're NYCHA, for instance, we would like to work with the tenant leadership. We would like to know that there is a settlement house or a nonprofit settlement or nonprofit senior center that's been in the building for maybe years or decades, and have them be the messenger that this is what you want to take. In addition, we want to make sure that, as time goes on and it expands in terms of who's eligible, we want to make sure that the language is appropriate. We have had some concerns, even though there's a language button up on some of the websites, that has not always been true on the call centers. And it hasn't been true, for instance, in some of the lines in where people are waiting to get in line. Even something simple like when you get to a center and you're older, you have to sit. You have to feel comfortable about the buzz of going to get a vaccination. So it's a combination, but the most important is whomever is in touch with you has to be somebody you trust, language-wise, culturally, race, age, persons who you have worked with in the past. Otherwise, it's not going to work. And the report that came out, I think today, indicated, particularly in the African American and the Black community, where there's the most distrust. But you will find that language barrier is also equally challenging. And we do not have, as I understand, despite all the work of the state and the city health departments, we don't have that kind of language access that's actually taking place, either written, the advertisements on television, social media are fine. That doesn't always get to the seniors. And what does not get to the seniors at NYCHA, robocalls and social media. You have to go under the door with the flyers. I've been in 3 NYCHA developments in the last couple of weeks with the state and the city. We had to actually go knocking on doors, because the other thing to make sure is give folks enough time to prepare themselves to come down and get the shot. You can't do it at the last minute, and that's unfortunately what's been going on. So I hope that's helpful It is definitely got to be a good messenger, enough time, a language that you understand in the broadest sense, and convenient. You're not going to find people traveling to another part of the city to get a shot. They will not go.
Okay, thank you. Ms. Carrington, this question I'd like to ask you to respond. If I've been vaccinated, do I still need to wear a mask?
Oh, that's one of my favorite questions. So, yes, what I would also like to share is that I've been vaccinated. I've had both of my doses. I had no side effects. And to build upon what the borough president just shared about trusted sources, those of us that have been vaccinated need to be able to demonstrate and be very transparent about our story so that people can offset their concerns. So I just wanted to throw that out there. The answer is yes, you should always wear a mask. You should remain socially distant. You should ensure that you stay home and do not congregate or go out in spaces where there are mass congregations, because although you may be vaccinated, it does not preclude you from being able to acquire the coronavirus. And while you may acquire the coronavirus, you will not get as sick, which is what we've talked about, and definitely not have an imminent path to mortality. But it doesn't mean you can't acquire. And at this point, it also has not been tested in terms of transmission. So we must always remain vigilant around all of the things that the scientists and our public health experts have shared with us in terms of the factors to offset. So wearing your mask is going to be a reality of ours for quite some time. And I would also offer not coming outside when you don't feel well. In the past, sticking it out and making sure that you always go into work and really pushing yourself when you feel ill has been something that's a part of the ethos and the makeup of New York. We're tough and we always power through. In this particular case, when you do not feel well and you exhibit any of the signs or symptoms, you should also not journey out of your home. Don't try to go to work. If you are around other people, don't go there. So I would say all of the things that we've learned are applicable throughout the entire course of this pandemic until we really are on the other side. So yes, you should wear a mask. Yes, you can still get COVID. Yes, you can still give COVID, although you have received your vaccine. So we just have to remain vigilant. This is really protection from mortality that we're talking about as it relates to vaccination.
Absolutely. And, our approach to it now is double messaging. Wear the mask, practice social distancing, washing the hands, and get vaccinated, certainly as the opportunity presents itself. And I'm pleased to say that I've had my first dose, and I had it right at Harlem Hospital. And I will tell you, it was a very, very rewarding and very, very pleasant experience. I'll share this, that when I did it, I had an emotional reaction and I couldn't figure out why was I feeling so overwhelmed, almost tearful. And as I processed it, I fully understood it. One, I was very grateful for having the opportunity to get the vaccine, and just so appreciative, thinking about everything that it passed. Then I was saddened because I reflected on the more than 400,000 people who have lost their lives, and that the vaccine had not come online soon enough. And because of politics, a lot of this happened, and that made me sad. So I recognized that was the emotional roller coaster I was on. So after I had the first dose, I sat down, I relaxed, I was calm, and I'm very pleased to say I've not had any after effects. So I thank you, Ms. Carrington, for all of the work that you're doing right there at Harlem Hospital. And I'm up due for my second one, I think in the next couple of weeks. Okay. Personal story time, right? So also let me ask Dr. Carey about another question we hear about. Some will not get the vaccine because they don't know the long-term side effects. It's the short-term benefit that overrides that unknown. We hear that a lot.
Yeah, that's a common concern. The answer is that, well, with vaccines, if people are going to react to a vaccine, usually the reaction happens pretty quickly, and even a reaction that happens later than within the first half hour often happens within 2 weeks or at least within 6 weeks. It's uncommon to have a long-term after effect of a vaccine. And these vaccines have been tested in the clinical trials started 10 months ago. So millions of people have been vaccinated over the course of the past 9-10 months. And so enough time has gone by that we would have seen if there were effects that were going to come up after a couple of months, and they just haven't. And it would be unusual anyway for a vaccine to have reactions that occurred months later. In terms of the concern about long-term side effects that we don't yet know about, there is that theoretical concern. However, the short-term benefit of not getting COVID, I think, far outweighs the very small potential possibility of a long-term effect that we don't know about.
Okay, and you actually responded to another question that had come up about needing to debunk information that some people think it's all been developed too fast.
Well, the science was not compromised in any way by the fast track that the development of these vaccines was on. There's a few factors that facilitated these vaccines to be developed on a relatively quick pathway. One is the mRNA technology lends itself to faster development of the vaccine than more traditional vaccine development strategies. Historically, the development of vaccines includes working with the virus itself, culturing the virus in chicken eggs, and it's a very time-consuming process. So the mRNA technology really lends itself to more rapid production, more rapid development. So the technology played a role. The other concern that people have about the timeline of the vaccine development is this is a new unknown technology, this mRNA. That's not true. As Dr. Watkins alluded to, mRNA technology has been around for 10 or 15 years. Researchers have studied this technology in other outbreaks. mRNA technology was studied in the SARS outbreak years ago. So it's not an unknown technology. It's a scientific technology that people have been working on for many years. The third factor that really led to these vaccines being developed rapidly is that the government put a lot of money into the development of these vaccines, so production was able to start even before the clinical trial results were finalized. That's unusual. Typically, when a vaccine is under development, production doesn't start until the efficacy results are back, showing, okay, yes, this vaccine works very well. It has a 80% efficacy, a 75% efficacy. Let's develop it. Let's produce it. In the case of the coronavirus vaccines, the efficacy is terrific. It's 95%, and production started even before the final results of the trials were known in terms of efficacy. So because of those factors contributed to the rapid development of these vaccines. So in no way was the science compromised by the quick timeline with which these vaccines were developed.
Okay. I think you also responded to another generally asked question, or maybe not, and that is, can you still get infected with coronavirus after getting the vaccine? I see you shaking your head, Sister Carrington, so let's go to you on that.
I think the answer is yes. Yes, you can still acquire coronavirus after being vaccinated. And what the vaccine does for folks. And this is what they said, well, then why would I get the vaccine? Well, because if you were to not be vaccinated and acquire coronavirus, you could die. You could be very sick. You could be in the ICU, and these hospitalization statistics could include you. After being vaccinated with your second dose and after a couple of weeks, your ability to fight the virus is very, very high, to Dr. Carey's point. So you will not be as sick. So the answer is yes, you can get coronavirus. You can have a positive PCR test after having received the vaccine. However, you will not be as sick as if you were not vaccinated. And that's what I really want people to understand. It's not a magic wand. It is not a panacea. It does not get us out of this pandemic immediately. It is a beginning step in a very long journey to the country being able to manage this as it does many other communicable diseases.
Okay. Before we shift to COVID testing, which is still very much needed in the communities where that are underserved, populations that are underserved, vulnerable communities, testing is still key. But before we go to that, let me ask Dr. Watkins, what percentage of the population needs to get vaccinated in order to eradicate the disease? I've heard, and many people probably, different people answer this question.
I mean, I think when people talk about herd immunity, I think they're saying above 70%. But I think it's important to understand that things don't happen in like a test tube or a bubble. I think it's multiple factors that will get us out of it. I think it's widely available, free, accessible vaccinations, but it's also folks doing those non-pharmacological things, such as continuing with social distancing, continuing with the mask wearing, washing your hands, getting tested frequently. It's all of those things that will help minimize the person-to-person spread, and we get out of this by all of those factors coming together to start breaking these chains of transmission. And I think when we think about vaccines, it's understanding that this is one of the tools in a pretty robust toolkit that we're preparing, but it's using all of the tools that we have available to get this thing down. And vaccines, again, are really important, and it's a game changer, but it's not, this doesn't end this pandemic. It's all of the things, especially those kind of social things that we've done before as a city, for sure. Like New York City, the biggest city in North America, in the United States, we did that. And we can do it again now with this tool of the vaccine. The end is near, but we gotta, come together on this, and hopefully the rest of the country and the world can kind of follow what we've already accomplished before.
Even though we hear a lot, and obviously we understand the populations we've been focused on, whether it's 1A and now 1B, and as they lowered the age to 65 now here, actually across the country. We're also hearing conversations from younger people almost feeling forgotten in all of this, anxiously wanting and waiting for the vaccine so that, of course, they're not in a position of possibly infecting older persons in their own families. So what's the message for us talking to younger people who anxiously want to get back to what they consider to be normal existence?
I can take that.
Okay.
I'll say when we consider vaccination, it's for our own protection, but it is for folks who we live with and who we are in community with. For folks who are homebound, who aren't able to get out, for the folks who live with them and who take care of them and who love them, those folks should be vaccinated, because you having less of a chance of being infectious means that you're less of a risk or a threat to possibly infecting your loved one. So it's that vigilance and taking care of the community, like the village that we live in, and whoever is in our village. It's part of that, like taking care of each other, So yes, I know a lot of young folks in my age group and also younger who are anxious to get back to the real world. Like we can't all do it alone. We got to do it together.
I saw that others wanted to respond to that question. So let's start with you, Madam VP, and then Ms. Carrington and Dr. Carey.
Well, we're all dealing with economy versus health. That's not a good discussion, but it does come down to that. So I just want to give some examples because I think testing has to be also part of this if we want to get back to work, which is also part of what many young people want to do. So I know that in testing, as an example, the governor wouldn't have been my first choice, but he had the Bills game in Buffalo. 5,600 people attended. And what the state did there was, again, that's a car culture, not a walk and pedestrian culture. But what they did there was you came in your car the day before the game, 5,600 people, you got tested. And if you were positive, it went on your cell phone. I think 10%, if you were negative, went on your cell phone. And if you were positive, you didn't get to go to the game the next day. The next day you came to the game, you parked your car, I assume. With your cell phone, you went into the audience and you watched the Bills game. And nobody got sick, I believe, and it worked. The same thing is happening on Roosevelt Island. That's a pedestrian area. And there is now, early in the morning till late in the evening, a site where you can get rapidly tested. So people are going there before they go to work. And if they have a negative test, which takes about 5 minutes, maybe 10 minutes maximum to get your results, then you go to the deli or you go to the restaurant or you go to the job. I just want to mention that Dr. Fauci says we need 85% of the population. People better than I can decide how many that is in the city, the state, the country, the world, and so on, and the travel issues. But I do think, to answer your question, it's not just wanting to get the vaccination to be healthy, it's also wanting to go back to work and be healthy. And maybe we can do vaccinations for everybody up to that 85%. But in between, when we're masking, washing, social distancing, maybe we could also find a quicker way to get tested so that we can go back to work. I just throw that out because Roosevelt Island is really happy with their program, and people in Roosevelt Island, now that's like a small town, it's not like being in Harlem and where it's much more complicated. But I just want to throw that out. We've got to do more testing in addition to the vaccination.
Great. Ms. Carrington, you wanted to respond to that question?
Sure. I think during the first wave, what we experienced, myself included, was a fear factor that was so crippling that we were kind of shocked into compliance. And everyone did what they were told because of that fear. That's what we have to return to, not being afraid, but being hyper compliant. To Dr. Watkins' point, these young people who live with older adults or who are the caregivers of those who may be considered homebound, they have to make a couple of choices for a couple of months until vaccination can be more available and prevalent outside of the older age groups. And so I'm just appealing to those individuals to hang on and hold on and be compliant. I live and work in Harlem and am very privy to a great deal of travel. I saw one of the things that came up in the chat was that people are still traveling a ton. And that is something that's problematic in our particular community because the back and forth that they're bringing back to their loved ones is really causing some of this contagion. And so I really just want to say we have to change our behavior for a little while. We have to not vacation for a little while. We have to not go party or smoke hookah or hang out together in confined spaces for a little while. So I'm just calling that out because that's real. And I want to do some of those things, not all of them. I specifically want to travel really badly, but I don't because my mother's 72 and my son is 5. And both of those vulnerable people really need me to be as cautious as possible. And so I've made a good amount of sacrifices. And so I'm appealing to the audience to do the same because until vaccination is available to young people, you do have to protect yourself differently so that you do not bring something home. And it's just as simple as that. Until it's available, you have to make some choices. And so choose your grandma, choose your abuela, choose your nana, choose the ones that you love by making a no to some of the social things that you're asked to do. And so that's what my appeal would be to the youth until they can actually take us up on the vaccination.
Did you want to comment further, Dr. Carey, on the youth question?
I think everyone else has touched on the points that I would have, but I would just emphasize that I think a lot of the youth see the vaccine as, okay, once I get vaccinated, I'm good. I can, do more things that I want to do. I can travel. Maybe I don't have to wear a mask all the time. It's not true. The vaccine, as everyone else has touched on, this is a multifactorial approach to getting out of this pandemic. The vaccine is not, getting the vaccine does not give you then a free pass to ignore social distancing, masking, taking precautions for many reasons. One is that it is still possible to perhaps acquire and transmit COVID after vaccination. A person is not immune the minute after they get their vaccine. It takes weeks for the body to develop the antibodies that give you protection against COVID. We see variants develop and spread. So there's a lot of things that people need to continue to do in addition to getting vaccinated.
Someone said, thank you for that information. I will stay home. So a young person said they're going to stay home. Thank you for sharing. Let me ask you, starting with you, Dr. Carey, about rapid tests and home testing. Again, our work, we're continuing on 2 tracks. Get tested, get vaccinated. They go hand in glove.
Yes.
We cannot overlook the fact that there is still a tremendous amount of work to get people tested. And we're experiencing some of the same issues with respect to where do people go to get tested and how do they receive the information. And that's why I started off with our program tonight, our webinar tonight, saying there's a lot of information out there. And I think sometimes those of us who know and take it for granted that because of the many ways that people can access information, they have it. Not true. Not true. So with rapid testing now and home testing, can you speak to that, starting with Dr. Carey?
Sure. So in terms of, there's a couple of ways to have a diagnostic test. There's 2 general categories of testing for COVID. One is antibody testing, which is a blood test, and that tests to see whether you've been exposed or infected with COVID at some point in the past, developed antibodies, and now you have a positive antibody test. So that's antibody testing. And that just determines whether at some point during this pandemic you've been exposed or infected with coronavirus. It doesn't mean that you're infected now. It's a past. Moving to the diagnostic tests, which is what you're talking about with the rapid testing, there's a couple of types of diagnostic testing. One is the PCR test, and that's a nasopharyngeal or a nasal swab that takes some fluid from the back of the nasal passage or from the throat and tests it for COVID, for genetic material from COVID. If that's positive, if the PCR nasal test is positive, that means you're infected now with COVID and you need to quarantine. The other type of diagnostic test is the rapid test, which is it's an antigen test. It's obtained the same way. It's a nasal swab. And the results of the rapid test, the good news about the rapid test is it's rapid. So the results can be back in 15 minutes, and it gives you a positive or a negative result right on the spot. If it's a positive result, you have to quarantine, you're infected with COVID and you have to quarantine. However, if it's negative, you may need to get a PCR test, the other type of diagnostic test, to verify that result is indeed negative. What we know about the rapid tests is that they do have some false negatives. The PCR test, which takes a few days to come back, the PCR diagnostic test, nasal swab, that is the more reliable result. So if you get a rapid test and it's negative, if there's a suspicion for possible COVID, you probably want to follow that up with the PCR nasal test. So both tests are very good, but the PCR nasal test that is not rapid, that takes a few days to come back, is a bit more accurate. The rapid tests are more accurate in people who are symptomatic, so it's useful in that context. But for asymptomatic people just sort of getting tested to know their status, the PCR test is a bit more reliable. However, any testing is better than no testing. So certainly getting tested by whatever means is available to an individual, and getting tested frequently, especially if you're out and about, is very important, because that positive test tells you to quarantine and protect yourself and others.
And we saw a comment that just came, a comment actually, that when they test both. Is that recommended or discouraged?
Well, I think that it does, if the rapid test comes back positive, there you have it. There's your answer. If you need to know in a short amount of time, you do have that positive result immediately available. I think there's probably no harm to getting tested twice. I think the more testing, the better. So.
Yeah, we just have to make it possible to get more testing done. And Madam VP, you had talked earlier certainly about a lot of the work you're doing around the vaccination. What are you seeing with respect to testing out there? Are people getting tested, want to get tested? Do we have enough resources out there? I do recall as we worked together at the beginning of this, how we had to really fight to get locations in central Harlem, the 5 zip codes. And I know that you're borough-wide, but you obviously was a part of leading on that effort to get appropriate and needed testing in the 5 zip codes that had some of the highest rates. And that was very disturbing that we had to fight so hard for that. So what are you seeing now with respect to testing and the resources throughout Manhattan as far as availability of resources for testing?
I think we still don't have enough testing in many places. I mean, we in our office, we have now got 4 or 5 people who are trained to be testers. This would be for the rapid test, obviously. And we have been doing it in Washington Heights. We get 100 people showing up without a lot of outreach. I will also say that, again, I've been in several NYCHA locations where there's been testing like a pop-up. The trouble with pop-ups, which is what we often have to answer your question specifically, is that, if they're there and then they're gone and people don't know to go there on a regular basis to get tested. Then you have the problem. I've been in Washington Heights a lot as an example, and you have just a couple of locations, and guess what happens? The lines are huge, sometimes an hour or 2 hours. Sometimes when people want to travel, I know we shouldn't, but people went away for Thanksgiving, they went away for Christmas, New Year's, and so the lines were like 2 or 3 hours sometimes. And that is very discouraging, so people don't get tested. And then the other problem is if it's not convenient, if it's not at the pharmacy, if it's not at the school, if it's not in the neighborhood, what the doctors and medical professionals say is get tested often is difficult. And then people think it costs money. It's free. If you have insurance, they'll take it, but if it's not, they won't. I really like the idea what Roosevelt Island is doing. We should be doing that everywhere. It becomes like a no big deal. I'm going to spend 5 minutes. There should be so many testing sites in Harlem that you don't have to wait, so that you do it as just, that's what I'm going to do this morning. So the answer to your question, in my opinion, is there are not enough testing sites. We, for instance, did one right in front of the, in a van. There's a wonderful group of individuals from the Latinx community who have a big truck, and they have been going to the NYCHA developments. They were 125th Street. The line was long to get people tested at that location. That's a pop-up. That's a weekend. And then we had one at a couple of housing developments in Harlem for 2 days. And the problem, of course, with all due respect to NYCHA, is they don't get the flyers out early. And then there was some confusion when people showed up whether you needed state ID or could you use your municipal ID, right? And it wasn't clear. So this has been a very frustrating experience. As much as the agencies, city and state and federal, are trying, there are just so many wrinkles, and maybe I'm the only one that hears about them all, so I feel a little challenged in terms of the process. I'm more challenged. I feel angry about the process. But we need more testing. It has to be in the neighborhood. It has to be easy so that you feel like you want to do it before you go to work so that you don't infect anybody. That until we get the vaccinations everywhere, I think we need a lot more testing.
Same thing. More testing, vaccinations, resources, all needed. Dr. Watkins, how often is it recommended that perhaps people should get tested?
So the standard is once a month or every 4 weeks, but I say that's just the baseline, and I think you kind of have to develop your own testing strategy for your lifestyle. So there's a lot of folks who, because of the nature of their work, they're in contact with a lot more people than, you know, the average person. So folks who are frontline workers, folks who are exposed to a lot of individuals who they may not know, those folks should probably get tested a lot more frequently. So it's definitely developing what is your testing routine, trying to stick to it, trying to identify the place that works best for you, that's the most accessible, and just trying to stick to that program. I will say that I'm very encouraged by the new administration and their commitment to making testing of testing supplies more available, and enacting some of the executive orders that can be done to increase production. So I think if we have more production of the essential things that we need for testing, having that more widely available, then we can make testing more widely available. So I think that hopefully will be something that we can see in the coming months. And I think just to speak to testing, I come from STI world. I've been an HIV doc for the last 3 years, and STIs, working the Bureau of STI control, and in the Central Harlem Clinic a few days a week. And I'll say, understanding that with testing, your test is only as good as that day. So if you go out and get tested and you're negative, but if you go to a party or you're around other folks, you're being exposed to new contacts. COVID is spread a lot more easily than sexually transmitted infections. But if you're out and you have new contacts, then those are new potential exposures. So just understanding that just because you had a negative test on Friday, if you were out and you did come in contact with folks, knowing that your status can change within the next 5 days, and you may in fact have been infected and have to get retested again. So it's understanding how the testing works and develop a testing strategy that makes sense and that you can actually trust the results and know when and when not when you can and cannot be around folks who may be at risk for bad outcomes if they get infected, or yourself.
And you mentioned STDs, sexually transmitted diseases, and I guess that raises the question because there's a great deal of discussion about HIV and vaccines, as HIV, we know, is an immune compromised disease also. And the question, can you speak about HIV and the vaccine? Are there any cautions or concerns that need to be considered in those areas?
So for HIV, I think it's really important to understand what it means to be on medications and be virally suppressed. So we live in a world where undetectable equals untransmittable, and a lot of folks who may be HIV positive, but who are on meds, antiretroviral, to the point where they can't even detect the virus in the blood, those folks, their immune systems are pretty much on par with folks who are HIV negative. So if you do have HIV, if you're living with HIV, or you know someone who's living with HIV, if you're on meds and you're virally suppressed, you should definitely get the vaccine. For folks who are at higher risk or may have come in contact with someone who was HIV positive, or you don't know their status, STIs are still out there. HIV is still passing around. So you gotta get screened for the other stuff as well, with frequency at the same time.
Thank you for that, because again, our work here at Black Health, it's about eliminating health disparities and promoting health equity. And our focus is on 8 areas health areas: HIV, hepatitis C, prostate cancer, breast cancer, mental health, cardiovascular disease, sickle cell, and one I'm forgetting. I'm sure Melissa will let me know what I forgot just that quick. But those are our focus areas in terms of our work. And the emphasis is on how do we continue to mobilize communities through education, create advocacy for purposes of changing policies, coming out of elected life, most recent one being that of Borough President Manhattan. We know that policy is needed, policy changes is needed. As a result, without that, we continue to see the same problems. So with COVID having unveiled so much about disparities and pre-existing conditions and populations that are most disproportionately impacted, our focus as we do outreach, as I mentioned earlier, is still on making sure there's an understanding about these other diseases and that COVID has raised the veil, but work still is needed in those other areas. With that being said, now I'm going to go and ask each one of you, you can take up to 5 minutes each, to talk a little about your work, what it is that you do. Our board president gave a very good overview of everything in her office, the many activities and issues that she's leading on. But in your work, what are you seeing? What do you think needs to be done in these communities in order to get more accurate information out there so that people can make informed decisions on their own about whether to get tested or not get tested? So starting with you, Dr. Carey, give us some information about Ryan Health. What are you doing? What would you recommend that we need to do and actions to be taken? That's how I want us to kind of conclude. We've identified issues, we've identified problems. What can we do? Dr. Carey.
So at Ryan Health, we have a network of primary care health centers in a lot of underserved areas. We have centers in Harlem and Washington Heights and the Lower East Side, in the Chelsea area, Upper West Side. Most of our patients have chronic medical conditions, are very affected by social determinants of health. And a lot of the issues that were raised earlier, things like getting access to vaccine appointments, if a lot of that process depends on technology, that's going to be very challenging for our patients, many of whom are below the poverty level and might not have devices available to them or not be tech savvy. So I think that finding other ways to make vaccination and other programs available to people is really challenging and really important. I think that education is so key. I think that educating people about why the vaccine is important and allaying people's fears, answering their questions, spending time listening to their concerns is so important and needs to be done in places where our patients can go and listen. Additionally, on the other hand, it's also really important to communicate to people how important it is to continue to care for their chronic medical conditions despite COVID. So for people who have diabetes, heart disease, emphysema, it's so important for those individuals to continue to get the medical care that they need. At all of our centers, we've taken the precautions to maintain social distance, to maintain a safe environment, so people really can come into their appointments and need to come into their appointments to get their chronic medical conditions cared for, to be in the best health that they can be, so that should they become infected with COVID, they're in the best shape possible to fight it off and not develop complications. It can be a really terrible situation if people with chronic conditions are afraid to come for the medical care that they need and then get exposed to COVID because we know that their communities are disproportionately affected. So education is so key. A lot of the things that we've mentioned, getting tested is really hard for people. Getting tested, if the testing situation involves standing online or being outside, that's going to be really difficult and challenging for our patients who may be elderly, have chronic medical conditions. One of the things that we were able to do during the height of the pandemic is we transitioned one of our health centers, our Ryan Frederick Douglass Health Center, into a testing site. And that worked very well because the patients could come and get tested. So I think coming up with solutions similar to that, coming up with ways to take care of our patients in their communities and provide education and support in ways that can reach our communities that may not have all the technology advantages that others do. I think those are really important, finding ways to address the challenges, the real barriers that our patients face.
Thank you. Ms. Carrington, tell us some of the things that you're seeing and experiencing at the various sites. I had mentioned where you are, Central Harlem, West Harlem, parts of the Bronx, and what are some of the issues that are being brought and challenges, and as well as, other good things that are happening that you'd like to inform our viewers?
Sure. So New York City Health and Hospitals Harlem is one of the 11 acute care facilities that comprise the largest public hospital system in the nation, formerly HHC. And we found ourselves at the beginning of the first wave of this pandemic, and personally, as a woman of color who lives and works in the community in which I lead, I found myself right in the crossroads, really, of a juxtaposition of a social pandemic and a clinical pandemic. I realized that the work that we do every day, and I'll speak a bit about some of the areas of focus or foci at Harlem, it really became important to me. And our work was just so much more meaningful when I saw how directly correlated the death toll in minorities was as a result of some of these chronic conditions. So as a public hospital, beyond financial stewardship, as an administrator, I need to make sure that people come here for safe care, that they leave free of hospital-acquired injury, that we work on chronic disease management and collaboration. We have several programs here at Harlem around what we call like treat to target, or making sure that chronic hypertension is well controlled, that diabetes is well managed. We are a metabolic weight loss center of excellence because within this primary catchment, obesity is the silent killer that we were not grappling with appropriately. And so we've worked in a very coordinated way to try to get obesity managed here. And that was one of the comorbid conditions that they said exacerbated COVID. So what we realized was that the death toll was as a result of something that was within our direct wheelhouse. My functional job description every day became the actual reason why people were disproportionately dying. And so the call to action was never louder or more severe for us. So what we turned into is psychosocial healthcare leaders. We look at homelessness. We look at the neighborhoods within people live that are food deserts. We want to make sure that people have access to good information in their schools and that health literacy is embedded early in the curricula. I have been so shocked because I have a 5-year-old and I see what they're learning. And he's brilliant. He knows about plating. He knows about food. He knows about carbs. These are things that have never been introduced before. And so when I look at how we were so hit by COVID, it just made my work so much more meaningful to be a person of color leading this hospital that is for the people. So what I would say is I have turned into the most credible messenger I can be around the work that we've done. We are at the churches, we are in neighborhoods, we are using our social media in different ways to express to people the importance of having a primary care physician, of having screenings, of taking their medication. And it's not lost on me that the difficult choice between paying your rent and paying your copay are what our patients are facing. And so never before has my work become so cross-pollinated between the social and the health sector. And so for me, I would just offer to folks, please take your health very seriously. Prioritize yourself. Make sure that if you have chronic conditions that you are seeing your specialist. I would offer to some people to make sure that your specialist isn't quarterbacking your care, because that's not what they're supposed to do. There are brilliant people like Dr. Carey that are primary care docs also, who make sure that people are well understood. And so the work that we do at Harlem is solely committed to making sure that this community hospital stands at the ready to further the basic health outcomes. We're not a quaternary center. We're not looking to be an advanced cancer center or do, thoracic surgery. We really want to anchor in keeping this community very safe and meeting all of their needs, including, surgical needs. So what I would offer to the audience is that Harlem Hospital, because of this pandemic, has recommitted to its own mission, has eliminated some of the noise that can creep into the healthcare ecosystem when you want to make some money and get into some more sophisticated stuff. And then COVID came and said never before has the need to focus on the basics been more present. And so that's what I would offer, that the social justice of it just rose up in me very, very significantly here, that I think that we need to partner and do more research. We participate in an All of Us study, which is a genomic research study that helps people of color have their DNA banked so that we can better understand ourselves, participate in scholarly activity, and ensure that there's minority representation. So, I could talk for 5 days about the things that we do here and how they have made a difference in this environment and how COVID has helped us appreciate the work that we've done. But I just use these last few minutes to just say I'm grateful for this time. I'm grateful for having been invited and really for the support not only of our current borough president, but Mrs. Fields, for you as well, and all that you're doing with your commission. So thank you so much for your time.
Thank you. And the one health focus areas I forgot was diabetes. So they did send it to me. That was diabetes. Okay, Dr. Watkins, tell us something about the Department of Health, Mental Hygiene, correct?
That's correct. I just want to thank everyone else for sharing the work that you guys do, and I think it's essential to keeping the city healthy. And as a public health professional with internal medicine training and primary care training, taking a different approach or kind of a city, like myself as a city doctor and a doctor for the community, and the health department is really focused on community health. So it's about building that infrastructure so that we can get folks the vaccines that they need, and having, we have the capacity to, if we have the supply, to vaccinate 500,000 folks in New York City a week if the supply meets there, and being in the health department and advocating for more materials so that we can get tested frequently and consistently. These are things that the health department is really working on. We're working with the state to be more liberal and try to get more people eligible for the vaccines, as the criteria are, we have to follow the state recommendations. So it's kind of all part of the bigger plan of really addressing the needs of the community and really looking for, personally, working within this big institution to kind of find new and innovative ways that we can actually address this crisis. We see conventional knowledge has been really limited, and we see how a lot of these bad outcomes continuously happen. And so we really want to work on how we can advance public health, how we can center equity, and make sure that we deliver the essential public health services to keep communities safe and thriving. Because we know, just like the African proverb, it takes a village to raise a child, but that child becomes an adult someday, and that village has to be healthy. And so my approach and what we're moving with the health department is to keep the village, the city, as healthy as possible, and give providers who are out in the community the tools to keep folks safe and healthy, give folks the information as it becomes available, make it available in an accessible way for people with different languages, people with different visibility, with different hearing, to try to make as much as the information as available for everyone, again, to the service of keeping the community healthy. So I just encourage everyone to keep, stay vigilant and just really understand that we've gotten through this before as a city, which is an impressive feat. And I think we can definitely do it again, because, I would rather be no other place than New York City through a time like this. And I'm honored and really, really humbled to be on this call and to be working with such esteemed panelists. And it's just really, there's hope in this. It seems like it's so dark and we can't get out of it, but we've done it before and there's hope in it. And I just want to share that hope and community in looking out for each other, and really, we can come together, socially distanced, and end this thing, guys.
Thank you so very much. And Madam Borough President, let's take about another 4 minutes, and you can give us a roundup or anything else you want to add.
Well, I want to say great questions. You're certainly in the chat. Everybody's saying this is one of the most informative sessions they've heard on the topic. So congratulations, and certainly you have phenomenal leaders in the medical field as part of the panel. I think I know some of them really well, and they have shown tonight. I'm a little bit, I always look bad of me to look at the glass a little bit half full, as opposed to completely full, and half empty is not completely full. I want to know that as a result of these, 400,000 Americans and 3,500 Manhattanites dying, that we have figured out something to improve the public health in our country and in our city. And I want to make sure that happens. So I get a little hopeful, and then I get not so hopeful. And the hopeful part, of course, is what we've learned, some of the lessons learned about trusted partners, the need for not having been caught with people of color suffering the most. That should not happen in the future. We should have more sites. We should have more, ready and to be able to deal with, God forbid, there should be another pandemic like this. But also, and you know better than I do, Madam Borough President, about what it takes in a community, whether it's fresh fruits and vegetables, whether it is, the exercise opportunities, whether it's more primary care doctors, whether it's different hours, whether it is, working at the location so that it's easier at the health center for both mental and physical, at the senior center or at the community center. And, all of that. Are we going to do that? That's what my concern is. And I have to say, listening to these wonderful professionals, you would think that will happen. However, and I don't want to pick on any agencies, the mayor and the governor don't work together, and I don't know that it's ever going to happen. So that's a challenge. And then the second one is just making sure that the resources end up at the wonderful Department of Health, East Harlem Health Center, as an example. How does that health center become the center of the community? How does Ryan get more support? How does Harlem Hospital get more support? Making sure the funding goes there, and with all due respect to the private hospitals, health and hospital gets hurt. So I'm here to say we got to change the way we do things in the future, and I hope that my glass, which is now half empty and not half full, becomes fuller with some of these ideas that have come out of this god-awful pandemic. So I want to say congratulations to you, but our work is never done, and I just want to see that the future has a different trajectory in terms of public health. Thank you very much.
And thank you. And the comments that have been coming up on the screen, as BP said, people are very grateful for the conversation. To hear them say that this is the most informative one they've had. And I think it's because, again, you're in the communities, you are understanding and hearing and responding to what the issues are, what the needs are, and you are not ignoring them. And that makes such a big difference in terms of how we see people responding. And before we close, I just want to mention again that my office have monthly programs on MNN, and we invite you to follow us monthly online. Encourage people to go, and I encourage people to go to our website at www.nblch.org. And not only will they see this particular program repeated, and that's the good thing too, with MNN, they're able to repeat programs, and people see it a lot. And sometimes people will tell me, "Oh, I saw you on TV and you were discussing this, that, or the other." And I have to think about it. What they're talking about might have occurred some time ago. But that's the good news. They still get information. So this has indeed been a very enlightening, informative discussion that we've had tonight. And the last person who just sent up a message that this was awesome. Thank you so much. And we hope that we've been able to provide really good information. But now you also know people in the Borough President's office herself. You know people at Ryan Center, Madam Executive Director herself. You know people at Harlem Hospital, Miss Ebone Carrington herself. And now you might not have known Dr. Watkins, but we also now have a new friend there at New York City Department of Health and Mental Hygiene. So these programs are brought to you again to inform our viewers, to engage them, and to be able to share information that we hope you will take, to heart. And I want to thank all of you, and I also want to thank your staff who worked with my phenomenal staff, led by Melissa Baker, my COO, in terms of organizing this event and making sure that all of this was done in a timely manner and that the pieces were put together. So with that, I think we have just 1 minute. If any of you want the last minute, I'll give it to you. If you want to just give out your website. Okay, Dr. Watkins, you're waving. Are you waving goodbye or you have a minute? Oh, you're saying goodbye. Okay. We thank you. We thank you so much. And I really do encourage you to continue to do the work that you're doing and to have supporters as our borough president in elected office, carrying your message forward, and our office being able to amplify it in the various places that we are. And as a national organization, we do this across the country. And as I move across the country, I share with people also the tremendous work that is going on here. So I carry you with me beyond just what you might see. Thank you so very much and for participating, and good night.